Hello there. Welcome. I am Dr. Jill Weiner. I am a meditation and tapping specialist. I specialize in physician wellness. And as part of my ongoing effort to expand my own consciousness and the consciousness of the world around me, I have been very interested in exploring race, bias, privilege, and anti-racism issues for the last couple years. And I've been doing this interview series on how COVID has amplified or magnified social inequities and disparities that were present well before COVID, how they've been magnifying them, and how COVID has really brought to light a lot of these issues. So I have with me today Dr. Janelle Peifer. Did I say that correctly?
You did, yeah.
Should have checked on that beforehand. I have Dr. Janelle Peifer. She's a Ph.D. She's a licensed clinical psychologist and assistant professor of psychology at Agnes Scott here in Atlanta. And she's a specialist in trauma and identity formation. And she works a lot with postpartum families and helping them cope with the changes of having new little ones in the house. And she's just an overall amazing woman. And I'm so excited to have you here today. So I know I just sort of introduced you, but could you tell those who are listening a little bit more about yourself and your interest in inequities and mental health?
Yeah, thank you so much, Jill. I'm really excited to be here and have this conversation. I think it's timely and it's going to become increasingly important as we continue further in this crisis. So a little bit more on me. You did a great job summing it up. I'm a clinical psychologist. I have a small group practice here in Decatur in the Atlanta area. I'm also an assistant professor and a researcher. A lot of my work focuses on how people connect across differences. So really relevant to this in the developmental process of how people come to know themselves as cultural beings and explore their identity, and also how they connect with others who they perceive as different, again, across some of the separations and barriers that we see get built up over time. And I also look at the transition into new parenthood and do research on that and the impact that that has psychologically and on people's functioning. But yeah, I'm really excited to think about how we can be proactive in addressing some of the concerns that we know are likely to be amplified when it comes to inequities, when it comes to these historically marginalized identities, and how that intersects with the mental health impact of this pandemic.
I'm so I want to get into this connecting across differences with you. I want to just completely side rail this interview, but we'll do that on a different time because
Yes.
I'm so fascinated by how I was telling you about an article that a friend of mine, an op-ed that she just wrote in the New York Times. I just read it this morning and completely blown away. And she was talking about how some of her neighborhood groups are blacklisting businesses that decide to reopen now. Right now it's May 1st. So it's businesses in Georgia are just starting to reopen and other places too. Really nice, otherwise nice people are just not having it. It's turned into this political divide almost. So, and it's not any nicer on the judgmental side. So this connecting across differences is very, very relevant.
Mm-hmm.
So can you talk a little bit, but we're not going to talk about that right now.
More on that
later. Could you talk a little bit about mental health issues before COVID?
Mm-hmm.
Let's focus on marginalized society, members of society, but also just mental health in general. What are some difficulties that people face in terms of getting access, maybe in terms of stigma, and how? And so start with the background, what it's generally baseline like, maybe some of the things people don't think about who don't have, other than maybe some mild depression or anxiety, which everyone seems to have. And myself, I've had some of that myself. But what are some of the things that we don't really think about even before COVID?
Yeah. So thinking about, we really need to know the situation that we were walking into before this all happened. What was already there. And what we know is that inequity shows up in a few different ways. And I'll start off at the closest, the most proximal level, that immediate individual level. We know that within individuals, those who've experienced marginalization based on their identity. So that might be people who are queer, people who are Black, people of color, religious minorities, or like historically like prosecuted minorities in their environment, or people who have non-conforming gender identities, particularly those or lower socioeconomic status, particularly if they have multiple identities that intersect, that they were experiencing more stress and strain by having to cope with the weight of some of the othering, some of the microaggressions, racism, both at an individual and systemic level. That shows up like very much so even in our DNA. Like we've found that it's heritable, like carrying that trauma of like having to have that awareness, being hypervigilant over time, like just actually like impacts us on a physiological level. And so that was at the individual level, you had individuals who were under stress and strain. To compound that, you had less access to care. So within my like professional community, only about 5% of psychologists are Black. And when you look across the marginalized, historically marginalized identity, it's pretty uniform. There's just low representation. So if people were looking to come in for treatment, particularly around these issues where they wanted to be heard, seen, and validated on that, they were finding a hard time to find people who they assumed looked like them or could understand their life experience. So that already was a barrier in some ways, that people weren't even seeking or thinking that that care was for them or that it could be for them. So when it came to accessing care, it was more difficult. When you compound other things like socioeconomic status and like being in a rural community or in a community with lower access to these providers, or even working in an environment where getting out of work to be able to go to see a therapist in the middle of the day just isn't gonna fly. Like to be able to take in Atlanta to get to and from, if you have an hour session and you have to commute an hour both ways, 3-hour chunk, that's like pretty much reserved for professionals, right? And so thinking about that, there wasn't that access. And then of course, there's like the historical stigma that comes from a really good place. Like psychologists and researchers did some pretty horrible experiments. Within our lifetime, like eugenics, like in the last 100 years was like a thing, you know, that people were being systemically sterilized for things that were like considered to be undesirable traits, like intellectual disabilities, you know, even sexual identity. So this mistrust, when people are like, oh, the stigma, they think about, oh, these communities just don't talk about, they think that it's something, but it's really well rooted. Your grandparents were telling you about times where people were going in to see providers who were sterilizing them. So that mistrust isn't just because, oh, we're too tough, we don't think we need mental health care. They're like frightened of providers and have been very dismissed and not seen in the interventions that were developed and the research that was done, many of whom are taking a deficit-only approach, and any conversations around race are from this position of less than. So there isn't a lot like that people feel drawn to. So you had those sort of underlying barriers. And then of course, insurance reimbursement is a big part of that, and access to health care. If you have excellent private insurance, you have or are able to self-pay, you have a menu of different wonderful providers who you can choose from. But if you don't have that same access, then you have a lot of limitations, huge wait list. And particularly in communities where it is harder to get away, up until this point, insurance providers payers were not covering teletherapy. They weren't covering these unique models that can make it much more accessible, much more wide reaching. So like all of this is sitting together in like this mental health kind of like pre-existing stew, and like making it such that these communities were getting less service, were getting less care.
Okay. So it's already super hard. Can you talk about what othering means? Because you use that word and I think I could probably figure out what it means, but I'd love to know what it actually means.
Yes, let's talk about othering. So othering is that sense of like disconnection from another person's experience. The ability to kind of look at them as separate and other, which in this pandemic is like highlighted tenfold. So even the the slow response by individuals and leaders to recognize that this virus could come to them. So this idea of seeing it as oh, this is something that's happening in China. They're so different. Their society is so different. This couldn't reach us. And then as it got closer to the shores, being like, no, now it's just going into these communities. And then once it hit Italy, people are like, oh, okay, Italy. And it kind of got closer and closer to identities that felt empathetically like available to people. I think that there is a temptation oftentimes with like a lot of these conversations is to keep a barrier from suffering and to take some of like the weight of personal responsibility away by thinking about how is this something that's happening to somebody else and that's not impacting me. And part of what like as a scientist and as a clinician, this pandemic offers a wonderful opportunity to really dispute that idea that these are these separations. Like our experiences are interconnected so deeply. Like especially I've talked a lot of times about people who have the ability and the privilege to stay home. Your experience in health is tied to the ability to the frontline workers to be able to do their work. Like and it sort of makes concrete something that was already there to begin with, that there are a lot of attempts to this individualism and the separatism that it's about me and what I do. It's not about what happens in my community. But we recognize now that more than ever that it's very much systemic, and what happens to the least empowered of us will come to the most empowered of us eventually, and impact us, even if it's like not only just altruistically or morally or ethically, although I think those are important too, but in really pragmatic and like lived concrete ways.
That's interesting. So othering is almost like you commit othering. You're not a victim of othering. I mean, you're a victim of it, but othering is the act of pushing. Okay. That's a really interesting term, and I'm surprised I haven't really heard it yet. But it makes so much sense. It's like everything our whole society is about is like, that's for other people, not me.
Yep, that's not me. And you can see how it really is meant to reduce anxiety about the uncertainty of the chaos and sometimes the fairness of the world. You look for, like, we know in social psychology that people look for intrinsic descriptions of other people's struggle and external ones for their own. So, and for those who they relate to. So for instance, if you see somebody who is currently without stable housing, you look at them and you say, that's because that can't happen to me because that person is other and they didn't do what they were supposed to do. They didn't, they might struggle with substance use, and that's them. And it kind of keeps that suffering at a distance. Whereas you look at yourself and you're like, oh, I might be struggling right now because I'm under a lot of like stress from my boss. These things out of my control are happening. And we even see that now in like the response to the pandemic. Like people are getting to that point where they're like, oh, this is happening more in, Hispanic and Black communities. It's happening more to the people who are already sick or the people who are elderly or have chronic illness. Like, so this is not me. This is something else.
I think my mind is just blown right now. It's this that's our whole, that's how everything is seen. And until like, you're like naked, in a storm, like clinging to the foundation of your burned down house, like you're gonna other, basically. Like,
yes.
Is othering something that people do even if they're marginalized? Like, do marginalized people like other people, or is it just something that people with privilege do?
Well, I'm working on a paper right now that's about this in a lot of ways. It looks like these layers of historically marginalized identities in this intersectional way, and the relationship with empathy. And so the idea that the antidote often to othering is empathy and like allowing in like the shared like experience and like those shared moments where you're like, okay, this is about us like together. And what we find is that it definitely happens like within marginalized communities. It happens to all of us. We're all vulnerable to it. There's a temptation to want to put up a barrier between suffering as much as possible. And it comes from an adaptive place. Like, it's a lot to live with the like frailty of our human existence. Like psychologically, we can't hold that often. So we find ways to defend against it, and find ways to try to not be in constant psychological distress about that, So I'm not saying, it doesn't come from a place where it's like, you're a bad person, so you do this. So everybody does it. But what we do know is that those with historically marginalized identities, at least in this research study that I'm working on right now, that we see higher levels of empathy, that because, and my hypothesis on that is that it's just a readiness of different cognitive frameworks and schemas that you're able to overlay. So like we've seen in the literature that people, for instance, who were in like multiracial marriages were more able to be empathetic about same-sex marriages, for instance, because they're like, I can understand what that felt like for me to like, you know, be in, and I think, yeah, like Georgia or Mississippi was like one, like in the last, like, you know, like 50 or 70 years allowed it, you know, like they have like, they're like, oh, I can understand what that was like for me. So I can really, it's not too much of a leap for that to hit me empathetically. But yeah, but everyone does it, but there is some suggestion that having that framework of wondering, of understanding what it feels like might make it more accessible for you to be able to empathize with others.
Sure. Okay. I like that. So that the antidote is empathy. That's beautiful.
Mm-hmm.
So, okay. So now bring in COVID. How is that worsening, magnifying? We've already got into it a little bit. How is that magnifying the, just the mental health issues themselves? How is that magnifying people's own struggles, but then also the access?
Yeah. Yes. So in terms of particularly like thinking about those who are from historically marginalized identities, I think at like this macro scale, there's this ongoing stress that all of us are experiencing. And regardless of who you are, you're experiencing it at some level. Like, and this ongoing constant sort of like fight or flight, trying to engage, whether you're, you know, thinking about this at an economic devastation level, like health or both, and you're trying to wrap your mind over this like huge reworking, that takes a toll, like, and it's a strain.
Mm-hmm.
Some people have more access to privilege and resources to be able to cope with that strain. And to figure out healthy like ways to be able to engage with and have like the time, the space, the resources to be able to cope through that. So that is definitely the case, that it's kind of undeniable that we're in a highly stressed situation. But that's going to hit people in different ways. Those who have more socioeconomic resources, who have more space, like even like at a very simple level, like we talk about like stay at home and yards. Like, so people who are like, why isn't everybody just staying at home? Like everybody should just stay in their home and their children should play in their yards, you know? And then people having to remind you, like some people, you're talking about staying at home. What do you think is the psychological difference of staying at home in a 1-bedroom apartment with like somebody, you know, who is, has like a partner who has a substance use disorder, trying to go to your essential work job when the schools have closed. Like the idea that this is like a completely different experience based on your identity, based on the life that you're living. And that those who are like historically marginalized or currently like experiencing that are going to experience stress and strain in a different way. And then to boot, there's less like access and like templates for like empathetic coping around that, and constant barrage of messages about like, you know, yeah, that idea that you're less than. Like I'm talking a lot with like individuals who are experiencing ageism pretty badly, like recognizing like, what does it feel like to feel expendable, like to people? What does it feel like to come from, like, we don't often think about age as a historically marginalized identity, but it definitely is in our society. Like, and you can see in that conversation where people are like, oh, it's just happening to older people. And you're looking at like people who are 65 and like, you know, 70 being like, so that, you know, that makes it better. And so, and we know that we're seeing much heightened rates of like anxiety, depression, upticks in domestic violence, and child abuse. In some ways, we're seeing like lower reports for child abuse, which is a red flag for us, and it's really concerning. And just really, especially as we're getting into like this next phase of the pandemic, and like, what does it look like when you're like, now we're just in this brave new world, and individuals like may or may not have developed the like tools to engage with it. We're just anticipating that there's going to be a lot of stress and strain. And also a lot of folks aren't accessing mental health resources at this moment. So like when I talk with my peers, and we've been like having a lot of conversations about the fact that like our referrals are just really, really down. So people aren't coming, and so you're looking around and almost everybody I know is like, you guys must be so busy right now. And I'm like, for our current clients, yes. For incoming clients, no. Like there's clearly this environment where people must be under stress and strain. All of these things are popping up and people aren't coming in for like therapy. New people aren't coming in as much. So there's that question as well. Are people getting the support they need?
Yeah. Well, I can imagine, you can try to imagine if you're living at home with in a 1-bedroom apartment with an abusive spouse and a kid, and you're an essential worker, you have to have the internet to have these telesessions. B, you have to have privacy where you can talk about it and feel safe in your house. And if that person's in the house with you, you don't feel safe. So I can imagine that that is also contributing to that a lot. Like, where do you find, it's like different than like, oh, I have a runny nose or, I like my leg hurts. Doctor, help me. It's like this person in the other room in the kitchen listening is threatening. So, so much to think about here. What resources do people have for anyone listening who is going through, I mean, I can imagine OCD, anxiety, depression, all these things are flaring up. Do you think like other diseases like schizophrenia, bipolar, like what is getting worse right now, do you think, because of COVID? And what are things people can do at home if they aren't able to access their healthcare, mental health professionals? And also, what are things like resources, hotlines, numbers that people can look for?
Definitely. So yes, so like pretty much all mental health concerns are exacerbated by stress. So like we often like take like an epigenetic approach even to like the expression of mental illness. Or like mental health concerns, in that you may have like a genetic predisposition or just sort of like at a like anatomic level, like some differences that make you susceptible, but that it doesn't express unless you're under a lot of stress or strain, right? Like that you might not see that. And so of course now like that stress could exacerbate like the expression of these or the worsening of these sort of concerns. And then to boot, on the other side of it, a lot of the things that would typically help you cope are not accessible to you. So as we would be thinking about like behavioral activation, social support, like connection with others, they're a lot harder to access, to utilize. So it's kind of like this twofer where it's like stress exacerbates the expression of or the severity of, and then on the other side, a lot of the resources that people would normally cope are less like accessible, more difficult. So of course we'd expect to see some of a worsening of these sort of mental health concerns. So yes, that's the bad news. The good news is though that there is the opportunity for engagement with different coping mechanisms that may have been more difficult to access before. So I mean, this like for you, like Jill, like for all my clients who I'm working with now, we're using some form of like mindfulness, like they're engaging in some sort of like meditation. And that's a hugely important skill set to have, particularly in times where there are things that are significant, giant, outside of your control, and finding ways to be able to cope and center yourself in the moment, like, and be able to flow through like, or engage with the unpredictability and stress and strain that keeps coming up. And then also for in terms of crisis resources, a lot of the crisis lines have changed their functioning to focus on like connecting people with providers. So in Georgia, that's GCAL, the Georgia Crisis Access Line, is a great resource to be able to use. The National Suicide and Prevention Line does text, chat, and phone resources for people who are in crisis. NAMI, the National Association of Mental Illness, also has a resource that connects people with therapists and providers across like the different spectrum of needs. So there are some of those, and even the CARES Act packages intentionally built in money for substance use disorders and suicide because they anticipated that there was going to be a worsening of that.
All right. Like, way to go, government, for having a little foresight.
No, I remember I was reading through the CARES Act one day and I was like, oh, okay, look at you.
Yeah. I'm like, that's the first good news I heard at all about any of it.
Yeah, yes. It's just, yeah, some good news. Woo! And thinking about that, and then also like almost all providers that are doing some form of teletherapy. So even knowing that a lot of the places that you would normally go to, like calling your insurance company or calling your social worker and trying to connect with a provider who can like meet your needs financially, question like all those, that a lot of them are doing teletherapy. I started a referral guide in Georgia of folks who are doing teletherapy. And the shortened link is just bit.ly/tele referral, so TELEREFFERAL. And it just has like a kind of like compiled list of people who are taking like new clients and doing therapy. And then the things like Psychology Today actually has a banner for everyone who's doing teletherapy. And you can search and like go through Psychology
Okay.
Today, and it kind of like match you with somebody who's a good fit. So there are different resources at that level, but then there's a lot of like home-based and like coping resources that people are doing who might not be in a place where they want to seek therapy or teletherapy right now, but who want to be able to kind of bolster their ability to cope with all of this, uncertainty.
So, okay, that's awesome. And so I'll do my best to look those up, but I may ask you to send me some of those resources so that I can post them. This interview's on YouTube. So I'll post that. All that information will be below in the description. What are some red flags for people to look for in themselves or in their shelter in place mates that I don't even know if people are sheltering in place anymore? I am. But what are some things we can look for to be like that you need to get help, like leave the house and go get help or call 911, go get help?
Yes. Okay. Really good question, Jill. And I'm going to start across the lifespan because I think that these red flags look different based on
Mm,
like age. And this question often comes up for people with children or, siblings or older people, like their parents who they're looking out for. Okay. So at the youngest age group with children, you might just see regression, a lot of irritability and acting out, an increase in meltdowns and tantrums.
mm,
Those are going to be signals that that child is struggling. So rather than looking at it as resistance or defiance, being able to meet them on their level, find age appropriate ways to engage with them in conversations, utilizing some of the resources that are available about talking to your child about COVID. We're at the point where it's really important for people to be able to have that conversation with their children because they're sensing something's off, their whole life has changed significantly, and there's developmentally appropriate ways to have those conversations. Up to school age children as well, you might see similarly change in eating, change in sleeping behaviors, change in just again some regression, irritability and anger. Those are all things that you want to make sure that you're paying attention to. Prevention and early intervention is always better than waiting for a crisis point, and it can't hurt to do a conversation and a consultation with somebody if you have concerns that your child's behavior has changed.
okay.
um, Up into adolescence, this is often like pre-adolescents and adolescents are the sort of hidden sufferers often, and they often get misinterpreted when they're really in crisis. And I think about them all the time in this crisis because a lot of the people who I've spoken with, my clients, my friends, they're like, my teen's doing fine. Like they didn't really like going to school to begin with. They're maybe like more quiet, but overall they're doing fine. I definitely think you need to keep your eye on your adolescent because as soon as you kind of like probe that and peel that back, you're like, they didn't get to, they're graduating senior, they're not going to graduate, didn't get to say
Yeah,
goodbye to
that's heartbreaking.
haven't like if they're doing fine, like something else is going on. So definitely looking for being able to make sure that you're carving out time to check in on them, and making sure that you have activities that can help build them their healthy coping skills, because if they are on their screens all day, if they're not getting outside, if they're not eating, if they're not showering, if they have changes in mood that you just might not be seeing because it's happening quieter. Like a lot of times people are like, you guys have really little children, so we see it though. Like whatever is
Mm,
happening, like we clearly see it. Oftentimes there's a parallel in adolescents need. They need the same sort of like support, connection, conversations. It just expresses a lot differently. So definitely looking for signs of depression and anxiety and crisis for adolescents, and monitoring, yeah, if they yeah, if significant things have changed, yeah, the big things are, you know, sleep, food, mood. You're expecting some variability, but just engaging in conversations about it, keeping an eye on it.
Yeah.
Um, as you get into adults, those factors of withdrawal, seeing change and mood again, if the any sort of for especially for suicide risk, signs of like hopelessness, feeling reporting a desire to kill oneself or not be around anymore.
Hmm.
Able to ask and like feel that you can connect somebody with resources if that shows up. Being able to utilize something like the crisis line, that would be a time to reach out. And a lot of people are concerned about, okay, if I have the suicidal ideation, if I'm in crisis, if I need some stabilization, am I going to get really sick? And one of the things to know is that there are like really intentional protocols in place in the hospitals that are used to dealing with psychological crises. They all have done really thorough like plans for responding to COVID-19. So don't hesitate
Okay.
the care or support that you need out of fear that you'll be in a general hospital or general emergency department. They have completely different protocols.
That's really, really helpful information, because I think everyone's like avoiding the ER like the plague.
Yeah.
But if you need, okay, that's really great. Is there anything? Okay, well, two last questions. First question is, as you mentioned, this is this like gigantic macro trauma. We're all experiencing it in our own ways. And a lot of people don't have the mental space to hear how other people are suffering. They're just kind of like, I'm in this. How do you approach that with people? How do you start the conversation, crack people's brains open a little bit to be like,
Yeah.
getting outside their own
Mhm.
world of suffering? Or do you even try?
Yeah, no, I mean, and I think that that one of the biggest disservices we've done is we've tried to expand people's views to thinking about others and others' life experiences and ways of knowing, is that we have made it seem like it's something that's in the corner that you do as almost a charity project, like altruistically, or like from this sort of I'm a good person standpoint. But like, and I think that that's important. But even more than that, like part of what I would say to people is that we know that engaging in these conversations ultimately is good for you. Like it's good for you, it's good for the like organizations that you're a part of and lead. It's good for like things like, yeah, just for capitalism, productivity, innovation, like positive outcomes and markers. So oftentimes people think that there's almost this paradoxical impact that people think that if they engage with others that it will be draining or that it will add to their stress and strain if they're taking that empathetic perspective. But what we find is that there's that paradoxical impact that it actually refuels them. So that being able to engage with and think about other people, it leads to better health outcomes, better mental health outcomes for you as an individual. And it doesn't have to be big. Like oftentimes people imagine that it has to be something lofty and, heroic. But the idea of even just taking a moment to, as you're engaging in a conversation on social media, to pause and hold like what we call like this dialectic balance, like being able to see it as both and. So as you feel that temptation to like double down on your own stance, like take a moment to pause and breathe and be able to put yourself in the situation if you imagine that you were the person who was having the conversation. And oftentimes, like especially on things where we can't see the other people, we imagine them as like the lowest common denominator. But one of the exercises that I do with my students is they have to interview somebody who has a fundamentally different viewpoint than they, on a point that they care about, like something that they care about deeply. And that their goal is to they then debate with another person the point that isn't their own based on like the conversations that they had with people who are different than them.
Oh, interesting.
Like part of it is like one of the things that I say is when you're imagining this conversation, when you're taking this empathetic pause to imagine somebody who has a vastly different world experience, life experience than yours, imagining it as somebody who you have respect for, who you think is a good person, who has a good heart, who is like who is doing their best, and then taking that empathetic pause to imagine it in that way. Because like when we go back to that othering we were talking about before, people often try to think of that othering in abstract, non-human terms, and that's where we see a lot of dehumanizing of others, like, and making them less than. But when you add their humanity back in, and when you say, like, and it's a hard thing to hold, you can almost feel the tension in your mind as you're trying to hold it, when you're like, this is something that I don't believe at all. And in fact, in some cases, I think if the other person feels differently than me, they must be a monster, right? Like, they must be horrible, or that they're trying to attack or undermine something that's sacred to me. But when you hold it and you're like, okay, what if I imagine that there are like billions of people on earth and billions of different experiences of this world, and somebody is having this vastly different experience that I know nothing of, and I'm trying to imagine how they might approach, they might see, they might hold this situation, that it can be a really sort of, it can just add different perspectives, it can increase empathy, it can be help that like feeling of like constant like us versus them, like you always got to have your dukes up, like, and creates the space too where you can have really creative problem solving, because we know it's never going to be the pendulum swing one way or the other. It's going to be somewhere in this gray space. And like on polarizing issues, like should we stay at home until there's a vaccine, all the way to let me out right now, there's somewhere in the gray where the answer lies. And the more that we're able to like engage with that, and the deeper that we're able to get into that, then we're going to come up with solutions and creative thoughts and ways to respond to this that are healthy and sustainable.
Yeah. So it's not about like guilt shaming people for wanting to be like not being able to have the bandwidth for it. It's not about guilt. It's like, this can actually help you.
Yeah.
Not like you shouldn't be stressed about your own life, but engaging in these thoughts about what's happening outside in the world can actually help you.
Yeah, that both and. We talk about it. You can think about your life, and you can have maybe even just a teaspoon of time or mental energy open up in that moment, but like, and it can be that you're continuing to strive to take on others' perspective and incorporate that into your worldview.
I had my landlord sent my toilet was leaking, and sent a plumber over on Wednesday, and he shows up at my house with no mask, no gloves. He's carrying like an old dirty pail of like Clorox wipes. And like, he's like, I'm here to replace your toilet. And I didn't even know he was, there's not really great communication with my landlord. So, and like, I was like, where's your mask and your gloves? And he was like, I don't have them. And I was like, I always have people take their shoes off. So I was just like, and then like his phone rang and it was a Leonard Skinner song. And I was like, oh my God, and so there was this total othering of like, I'm better than you. You're this man who came into my house without your things. And so it was really, it was very easy for me to jump into judgment of him and dismay that he would show up without these things. Health-wise, I do think it's an issue, but his ringtone informed everything I needed to know about him, evidently, like I like ended my judgment there, and he is who he is. So it's just a very weird situation that I was in, but I've learned a lot just from talking to you about that, someone within my own racial identity, but certainly at least appears to me, not in maybe a different intellectual or political. My perception of that was real easy for me to jump into judgment there.
Oh, heck yeah. No, I mean, and it happens like to all of us all the time. And like when I'm talking with my friends, and, because I'm an academic, I'm surrounded by like, people who think about things in a very specific way oftentimes. I mean, there's a lot more diversity within academics than people think, but still, like they approach it in a specific way, and they often come from a specific life experience. And often, like I have the conversation, I'm like, has anybody ever convinced you to change or come closer to a way of being by like looking down on you, shaming you, and telling you how much of an idiot you are, and like disregarding your life experience? Like, no. Like, so even from like that selfish standpoint, if you want to create change, the best way to go about doing it is like through empathy. Like, like nobody, we saw that we just don't see behavior change. I talk with like my physicians who I work with all the time. And like, as we're talking about like motivational interviewing, and they talk about like, if they don't want to die, they should stop doing this thing. And I'm like, everybody knows cigarettes like kill you now. Like that's not news anymore. So you like shaming and like, telling somebody how much of an idiot they are for doing it. It like, if that was going to work, like,
right.
But yeah, so like the idea of if you want to like create change, like you're always going to be able to do it much more effectively from like a relational standpoint. I mean, and I know that that's my approach. Like I have other people who I love who are like, nope, my job isn't to like nanny or babysit people's emotions. And I'm in a place of like anger and activism, which I think is legit too. Everybody has to approach it as who they are. And my approach is always kind of like, yeah, if you're trying to create sustainable change, oftentimes it is from that space of being like, okay, like this worries me that you're like, you know, my, like, how can I learn what is going on with you in a way that will help me to potentially create some change for us together, both in you and in me.
That's beautiful. I love that. Is there anything about race that has gone unsaid in this interview that you would like to share?
Yeah, race. Okay. Yeah. I mean, there's a lot. And I mean, I think especially right now, like with the media's focus on, you know, like the impact, the disproportionate impact of COVID-19 on Black folks. One of the things that like, that is just like an enormous point of pain for me personally, of course, like for so many reasons. One of the things that strikes me is I think that these conversations, when we talk about race, have to be paired with action, because like the sort of like repeated micro trauma of just being told like that, you know, your people are at higher risk in dying, or are not be given the same quality of care, has to be paired with, okay, then what? Like, so what does that mean?
Mhm.
How respond, and not getting comfortable and acclimated and desensitized to that, because the more that it happens, the more that it's said, it can just create that othering again, where you're like, the whole purpose of this is to create like this separation. But if it's then saying, we're seeing this, but why? Like a big question to me is like, okay, in Atlanta, if I'm like, do you think that it's coincidence that we're seeing these higher rates, and the people who are delivering your mail, taking your trash, like delivering your food, getting your groceries in the grocery store, like every of these like essential workers without the personal protective equipment happen to be Black or from lower socioeconomic statuses oftentimes? Like, this isn't a coincidence. Like, we have to take this and then not just keep it as, and the idea of like, okay, then it's an individual level issue that's in some ways of oftentimes like placing the blame on folks, but thinking systemically, what is going on that would make this happen at a higher rate? What do we need to think about? How do we take this information and strategically invest resources, time, expertise, and energy to correct it? So I think that ongoing, that kind of mental health strain, it really adds up like over time if it's not addressed. And then also thinking again about access to care, like in how that shapes then getting the support, and even knowing that there is support that is informed and speaks to all these different elements of identity, that there are providers who are eager to, excited, and like creatively trying to think about how can we meet more people where they are as who they are every day.
Yeah.
And that, one of the things I'm hopeful about in the future is that we're taking a lot of what we learned through this crisis, like accessibility and care, like telehealth regulations got really very much so opened up in ways that I hope are sustained, because they're fantastic in terms of making our services more accessible to communities that before we were just saying, oh, we can't reach them. Like, you know, we can't do it.
Yeah.
I'm hoping that we continue to advocate for and lobby to maintain that access and resources.
That's great. I mean, a lot of the conversation has been like, oh, because Black people are poor, or because Black people don't have whatever. But it's like, no. They're not inherently poor. It's not because they're Black. It's because of racism.
Yeah, you're like small detail you're missing.
That it's like, let's not forget. Yes, that's sort of the reality of what we're seeing for some communities. It's obviously not all, but like every one of us plays into this systemic issue that is causing these inequities and this lack of access. Me sitting in my home, you know, like I play into it too. It's not, it's blame, but it's not, because it's if you recognize it, then you can take part in it. But the othering of, I'm not the racist one, they're the racist one. That's, I think, a big part of the problem too, is not acknowledging your role in what may be causing these issues. So, okay, how can people work with you? How can people find you? Are you on social medias, websites, all the things.
I'm so bad with social media, but I have a website. So my website is for my practice is www.onwardandoutward.org. Our practice is Onward and Outward Psychotherapy. So if you wanted to reach out via that, like my practice is actually doing like free wellness consultations during COVID. So just to anybody who needs it can do like teletherapy consultations for 30 minutes. So if you need resources, you just need to check in with somebody, please utilize that. That's why it's there. We really wanted to try to lower as many barriers to care as we could.
That's awesome.
And yeah, so that's how you would start reaching out to me. There's contact form, you can find me. But yeah, so I really appreciate though being able to have this conversation.
Of course. Well, thank you so much for bringing your expertise here. There's so many layers to all of this. And like the more people I talk to and interview, the more I'm learning and realizing just how far we have to go. But there's a lot of work that's already being done. And I think just starting to have awareness, even if you like don't know. I mean, I spoke to a Black woman the other day who did not know the term microaggression, which I thought was very interesting. She lives in Alabama. So
Yeah.
like everyone's at different levels of
Yeah.
understanding of the systemic nature of what actually goes on rather than just experiencing it without having terms for it sometimes. And I hope that people find this interview helpful. I certainly did. And I can't wait to put it out there. So thank you so much for taking the time to talk with me, Dr. Janelle Peifer. And thank you for all these resources. I will be posting them in the show notes. So there's a lot of great stuff for people.
Yeah, well, thank you so much, Jill. This has been wonderful, and I'm hoping that, like, yeah, more people come in and join like this process. It's like, it's good work, and we're looking for people to be a part of it together.
Awesome. Thank you so much.